Assalamu alaikum. My name is Dr. Muhammad Awais and I'm assistant professor in pediatrics. Our today's topic of discussion is pediatric history taking. So this is the part 1 of history taking video. Actually, in pediatric history, it is almost the same as in every specialty of medicine or surgery, but here we ask about a specific relevant question about birth history and vaccination history and nutrition and also development history. We'll talk about it later on. How we start taking the history. We introduced ourselves. Like, my name is Dr. Muhammad Awais, and I'm going to ask certain questions from the history so that we can make a certain differential diagnosis, and we would be able to plan some management. Then we ask about child and the parents. So in the start, we ask about the name of the child, his or her age, definitely gender and parents' name, and their education, and where the child is residing at the moment, and when he or she presented to the hospital, like how many days ago, and where he or she came to the hospital, like in OPD or in emergency. So kind of biodata we ask in the history. Then we ask about the chief complaints, the reason for which the parents are coming to the hospital. These are presenting complaints, and these are the complaints like fever, cough, vomiting, and loose motion. And there are so many symptoms actually, or problems with which the patient usually presents in the hospital. So the presenting complaints should be in the form of single word, like fever for 2 days the duration, and for example the next second presenting complaint could be cough for 1 day. So this should be in chronological order, like the complaint which the problem which has happened first, we will talk about it first, and which is later, which happened later, we'll talk about later. So like fever for 2 days and cough for 1 day. Then we would explore each of these symptom in history of present illness or history of presenting complaint. Like, we would start from a simple sentence, history of present illness, like my patient was in usual state of health 2 days ago when he developed fever which was high grade, intermittent, maximum 1 or 2 degree Fahrenheit, relieved by taking medication like paracetamol, and associated with cough, and there is no history of any other sibling or any other family member involved having similar kind of fever or cough. So we talk about different questions. We ask different questions from the attendants or the parents regarding a symptom, like the duration of fever, the onset of fever, progressive nature of fever, and the variation, like from day to night, and aggravating and relieving factors, the possible causes or etiology of the fever, the complications which you have in your mind, like febrile convulsions, and the risk factors, any other family member involved. Similarly, other symptoms could be explored on the basis of same criteria. Actually, it is a bit difficult for the starting student, like in 4th year MBBS, but with the passage of time, you would have sufficient clinical background knowledge, then you would be able to ask a number of questions about a single symptom. But there are some mnemonic used for the history of present illness. You can also use them as well, like DOPA CCR, DOPA CCR. So disease duration, O is onset, P is progression or regression, A is aggravating or relieving factor, and CCR. First C is for causes, and second C is for complications, and then his risk factors. After exploring one symptom, the next symptom, for example, we have discussed cough for one day. We'll talk about cough. So cough is like we'll ask certain question. Cough is there for one day, and it is gradually in onset. Now has been increased, progressively increased, more in the night or evening. And we can also ask relieving factor, like it has got some relief intermittently with the cough syrup. The causes, like we can ask about uh, the fever, which is the infective cause. We have already asked the complications, any hemoptysis like blood in the sputum, and during cough, or any type of cough like chesty or dry cough, or it's wet cough, or it's croupy cough, or what kind of cough is pertussis like cough. So we can ask about the cough and the risk factor. Is there any family member involved having similar cough for longer or a shorter period of time? So with this, we 2 to 3 complaints and did exploration. I mean to say that asking different kind of questions. With this, we usually end our history of present illness, but sometimes we can extend the history of present illness. We can ask certain questions like what medications have been taken from the local doctor or GP, or what medications or investigation have been tried in the hospital during present admission. Like if some patient is admitted for 2 days, certainly we have done certain investigations, and what the doctors have told about the disease. And if sometime you come across some older kid who is going to school, you can also ask about the school history, like the child is going to the school or not due to the present illness currently. So these could also be included in the history of present illness. And immediately after history of present illness, you would ask about systemic inquiry, which are actually the history questions into the different systems, like cardiovascular system, GIT system, respiratory we have discussed already. So in the systemic inquiry, we can ask about central nervous system, or musculoskeletal genitourinary, was any simple questions like any urinary bowel complaints, any headache or dizziness or anything like this, or any joint problem or muscular problem. And then we would ask about some little about past history, like is there any procedure, any surgical procedure has been done in past, has the child been admitted with a similar kind of problem in the recent past, or any other hospitalizations. And then we will start our pediatric history, so which we will cover in the next part 2 of the history, pediatric history, and then family history, socioeconomic history, drug or allergy history. If you have any question, you can ask in the comment section. Thank you very much.